Hello, everyone, and welcome to this webinar hosted by ASPA's section on democracy and social justice, the dual pandemics fostering equity in the face of COVID-19 and racism. This panel is moderated by Dr. Susan Gooden, and my name is Sean, and I serve as chair of the section. This event is being recorded and we posted on our YouTube channel and shared over our media outlets after the event. I'm going to be remaining largely off camera for the duration of the event, which makes editing the video easier. But before we get started, we'd like to let you know about our next webinar, which we held next week on Tuesday, August 18th from 1 to 2:30 p.m. Eastern Time. This webinar features these 4 amazing panelists and is part 3 of our section's webinar series on ethics education. And we're going to be sending you the RSVP link through the chat, and we hope you're going to be able to join us. One other thing we'd like to let you know is that our section is sponsoring 2 journal special issues, and we're going to be sending you the links to the CFPs as well. So the first is an administrative theory and praxis and is a companion series to our section's Dismantling White Supremacy series. The lead editor is DSJ board member Dr. Brandy Blessett. And the second is in public integrity and is a companion issue to our section's ethics series. And we hope to have a Taylor and Francis webpage for the call soon, but in the meantime, we're going to be sharing with you the Twitter announcement. And the lead editor is past DSJ chair, Dr. Richard Gregory Johnson III. And we hope all of you consider submitting proposals and papers for these series. So without further ado, I would like to get started, but before I turn it over to Dr. Susan Gooden, I'd just like to introduce her. So Dr. Susan Gooden, we're lucky to have as the moderator of our panel today. Dr. Gooden is the Dean of the L. Douglas Wilder School of Virginia Commonwealth University, and she holds a PhD in political science from the Maxwell School of Citizenship and Public Affairs at Syracuse University. And also she is one of the most prominent voices noting how COVID-19 and racism, especially as manifested in police killings of Black people, is a double pandemic. And we're going to be sending you a link to her recent statement through the chat as well. So with that, I'm going to stop the screen share and turn it over to Dr. Gooden. Dr. Gooden, the floor is yours.
Well, thank you so much, Sean, and thanks to the Democracy and Social Justice section for holding this webinar and the webinar series that you all have been holding recently in the past several months, and this has been excellent, and thank you, Sean, for your outstanding leadership. It is indeed my pleasure to serve as moderator for today's panel, which, as Sean mentioned, is focused on the dual pandemics of COVID-19 and racism. And we have 4 very highly distinguished experts with us for this panel that I will introduce in alphabetical order. And we really want this to be more of an armchair discussion format. So I will ask questions of the participants, and then we will open it up for Q&A. You can submit that through the chat function, or you can raise your hand using the function, and we can call on you and you can ask your question. So we're pleased today to be joined by Dr. Richard Gregory Johnson III, who is department chair and professor at the Masagon Graduate School of Management at the University of San Francisco. We are also delighted to have with us Dr. Patria de Lancerjunes, who is Associate Dean of Academic Programs and a professor at the Austin Marks School of Public and International Affairs at Baruch College. And she is also a member of the CAP board, the Center for Accountability and Performance Board, which is also a section of ASPA. Our next panelist is Seth Meyer, who is an assistant professor of political science at Bridgewater State University in Massachusetts. And our final panelist is Blue Wooldridge, who is a distinguished career professor and professor emeritus at the L. Douglas Wilder School of Government and Public Affairs at Virginia Commonwealth University. So welcome to each of our panelists, and we'll jump right into the discussion. And so I think I would like to start by asking Richard to talk a little bit about, Richard, I know you have a lot of expertise in human resources management. When we think about both pandemics in terms of COVID-19 and racism, there are multiple HR considerations, whether we're thinking about disciplinary accountability and law enforcement for police officers, or whether we're thinking about disproportionately how Black and Brown communities are working in positions that we call frontline positions in the pandemic. So can you share with us perhaps what are some key HR strategies that we need to be thinking about and deploying during this time?
Good morning, Dr. Gooden, and to the panel, my esteemed colleagues. I am so excited to be with you all this morning and to discuss this very important topic. Um, I would say, first of all, one of the things that that HR departments, regardless of which organization we're talking about, but specifically about frontline law enforcement, is the fact that HR departments and the like must do a better job of hiring and attracting talent that represent larger communities. We are still living in a day whereby Black and Brown people are vastly underrepresented in many of the professional ranks in our society. Certainly, we can find on the other side a disproportionate amount that occupy sort of service positions, which, and of course, those positions are important, but we do need to see a better representation of, again, Black and Brown people, women, and so forth, in particularly with law enforcement, and even in the ranks of higher education. Um, you know, Susan, we are extremely proud of you being the dean of the Wilder School, but there's only one or a few of you in that role, and certainly Patria on this panel, we are extremely proud of her for being associate dean at Baruch. But we've got to get more folks in there. We've got to get more folks in there that look like the greater population. And it's particularly important in public administration because we are expecting our students to go out and to lead society. However, if they're not given those opportunities, then essentially what are we teaching them? So the second thing I will say very quickly is certainly there's a need for cultural competence analysis when an applicant is applying for a position. Again, regardless of which position, there's a, you oftentimes with HR applications, again, whether it's higher ed or law enforcement or what have you, there's perhaps a box that you tick. Do you know anything about diversity? And you check that box and that's it, right? But there's no follow-up, there's no real investigation in terms of whether or not these folks are really having an understanding of cultural competence and all that that involves. And so I think that we've got to do a better job with this. We certainly HR, certainly an example of this would be in San Francisco with the law enforcement officers. This happened a couple of 3 years ago. It made national news whereby police officers were caught having said some rather inflammatory racial things and homophobic things, comments on their text messages. And one would argue that, well, they were just, doing things in their personal lives that maybe were not good. Well, they weren't good. And, but we've got to employ people that, again, not only talk one way at work, but live that life. And so I could go on and on with that, but I won't because you've got to get on with your other questions and to our other panelists. But I think the last thing that I will say just around this topic is that HR really needs to lead the way in terms of creating spaces and policies that are that help hold people accountable when it comes to cultural competence, right? And Dr. Gooden, I know you've written a great deal about that. Blue has a number of people on the panel, Patria, Seth. We've all written about this topic, but accountability is what's really needed when we are talking about HR policies and the institution, because these policies, these spaces send a strong message in terms of what the values are of the organization. And the same way that I know at my own institution, University of San Francisco, we take online a sexual harassment workshop every 2 years. And I think that there needs to be some type of module or training that does the same thing for cultural competence, diversity, and inclusion, and the like, because I think that what we're doing now overall is really not working. So thank you. I'll leave it at that.
Thank you so much. Those are very insightful comments. And you bring up the topic of accountability, which when we think about accountability, sometimes one of the best ways to think about accountability is performance measures and performance measurement for individuals and organizations. So I'd like to bring Patria into the conversation in terms of thinking about performance measurement. Now, when we think about COVID-19, we get daily reports about the case numbers of COVID-19, the case counts, the testing, the death counts, and all of that. Patria, you have any thoughts on what performance measures we should be using to gauge our success or failures relating to eliminating COVID-19 and structural racism?
Thank you, Susan, for that question. And it is actually a complex answer because it is not just about developing the measures. And I'm going to say there are 3 things that we need to do, fundamental things that have to happen. If we want to mitigate COVID-19, particularly the effects, particularly among the communities of color. So the first thing that we need to do is to disaggregate data. Okay, disaggregate data, continue to disaggregate on race, ethnicity, among other indicators. The second thing that we need to do is to develop more agile performance measurement systems so that we can actually take action when action is needed. And third, we need to make sure that as a society, we declare that social injustice, that social justice is a public value. It is a public value because it is only until we do that that we are going to develop performance measurement systems that can actually help us to address racism. So let me just say as an example, and it gets back to the question of accountability. And I know some of you are going to hate this example, but I'm going to put it out there. So the No Child Left Behind Act of 2001 had an accountability component that requires schools to collect and report disaggregated data on the student achievement. That wasn't happening before. So we certainly can argue that that disparities have continued, but and that the causes of these disparities have not been addressed. At least we have the data that is still for someone to decide that we need to do actually something about it. So the data is there. This also brings me to a little bit of a warning that I'm going to say a spoiler alert. Performance measurement do not tell us why this is happening, okay? But it is telling us, for example, in the case of achievement, that our children from from disadvantaged groups and community of colors are not achieving. So this is actionable information that tells us that something is wrong, and it tells us then that we need to figure out why. And we could apply the same principle to the COVID-19 so we can start addressing the structural racism. At the time of the No Child Left Behind in 2003, President Bush said that education was the greatest civil rights issue of our time. Well, guess what? I dare to say that racism has been the greatest civil rights issue in our country. And it is excellent that Governor Whitmer of Michigan has now declared a health crisis, which is a step in the right direction. So that's with regard to the performance measurement system. The second thing, just to give a little more context, is the need to develop more agile performance data collection and reporting system. And the fact that the system should not be seen or become an added burden, but a complementary and essential to service delivery. This is particularly important in the age of COVID-19 because we are learning as we go on this virus. And so we need to have very quick insights from what the treatment outcomes are. Let us take as an example, quality of care at hospital. Unfortunately, I mean, and this is all over the Journal of American Medical Association, quality care of data lags 12 months. Well, that is way too late for us to correct any kind of disparity. And is the data useful after 12 months? Of course, but it is in the short term that we need it. And that's exactly what the purpose of performance measurement is, to give us periodic data. So we right now don't know, for example, what are the rates of infection for COVID-19 patients versus non-COVID-19 patients. We also don't know whether COVID-19 patients that are of minority groups are being given different kinds of treatment, for example, than COVID-19 patients who are white. Also, we know, again, we don't know about the infection rates, for example, in hospital, but what we do know from existing research is that non-white Hispanics and Blacks have a higher rate of hospital-acquired infection. If we had real-time data, we could do something about it right now and avoid a lot of different deaths. So I will leave that at that, and I can expand later if anybody has a question. But finally, the last thing that I mentioned is that as a society, we need to talk about social justice as a public value, because you see, some of the data that we need to collect could actually be used against the people who we are trying to help. And this is particularly the case for Hispanics. Let's just take as an example, just zip codes. It was great that we are disaggregating about zip code, but we also know that zip codes are great, great predictors of health outcomes. But for example, in a city like New York, we have a lot of variation just from block to block. And so there is something masked when we are just looking at this, at the zip code. We need the four additional digits. But HIPAA prevents us from getting this information for good reasons. Because guess what? If we have this information, it could be used to profile individuals in those blocks. And that could be detrimental, particularly the way that our current administration is working. So until we decide that this is a public value, until we decide that social justice is a public value, we are going to have difficulty developing performance management systems that can really help us to address the structural racism that we know has always been there, but COVID-19 has magnified. So that's mine for now.
Right. Well, thank you, Patria. I mean, you've done a great job in terms of having us think through some of the contemporary issues that we really need to think about relative to performance measurement in this environment. I also think it would be helpful for us to include a historical perspective. And so for that, there's no better person to turn to than my colleague, Blue Wooldridge, who is the resident historian on all topics related to social equity, as we all know. Welcome, Blue. And one point of comparison, oftentimes when we're thinking about COVID-19, there's a lot of reference to the Spanish flu of 1918. And then when we think about racism, and the Black Lives Matter movement, there's been a lot of comparisons to the civil rights movement and to the riots, the Watts riots, Newark and Detroit, the Kerner Commission report, and all of that. So what lessons from a historical perspective from both of these time periods do you think are most applicable for us today? You have to go out for mute.
Okay, I guess I'm unmuted. Thank you, Susan. As normal, when I was still on the faculty and you were serving as dean, I'm going to ignore your immediate question for a minute and just step back a little bit. One of the things, well, a couple of things I was thinking about when Ricardo was talking. Yesterday and tomorrow and Friday, I'm leading a training program for our State Department of Mental Health, Mental Retardation. They have a professional development program, and it's on diversity and social justice and high-performing organizations. But a question came up, an HR question came up in the chat room, and this person asked that does focusing on diversity lead to a lowering of qualifications? And my true belief in this, and it gets back to HR, which I'm also interested in the fact that one of the things that we have to do is to re-examine our job description. And we need to re-examine the qualifications we have listed. Because my response to that question, I don't know how successful it was to try to point out that diversity in itself by representative organizations, representative bureaucracy, racial and ethnic concurrence between, for example, health professionals and their recipients, patients, and so on, is a qualification in itself. And that the traditional qualifications for so many of our jobs aren't broad enough to bring in this workforce segmentation that we've been talking about. So in HR, let's go back to the job descriptions and make sure that they really represent the qualifications needed by incumbents of this in this profession. Now, contrary to my panelists and Sean as the organizer, I was not around during the Spanish flu epidemic of 1918. I came in on the end of that, but it has led me to doing some research upon that. I was around for the civil rights movement of the 60s and 70s. And it is kind of interesting. There are, from my brief research on this area, and it's interesting, there's a history professor at Virginia Tech, where both Gooden and I once taught at different times, who's been doing a lot of writing about the history and his graduate students of pandemics, and particularly of the Spanish flu lessons going for COVID-19. But one of the things, several of the takeaways, of course, seems to occur was, of course, as of this point, the Spanish flu pandemic was, of course, it lasted longer, but was much larger than the COVID-19. They don't even know the number of deaths because data was not, going back to Patria, data was not collected that accurately. Somewhere between 20 to almost 100 million people were infected, and obviously a higher death rate. Interestingly enough, my readings indicate that the original data of performance measures indicated that people of color were less affected in those days. Now, the assumption is that the data collection was very unreliable. A lot of the people of color did not make it to the hospital, so they were not picked up by the official data. But the recordings of the racial disparities between deaths from the Spanish flu would lead us to believe that it was higher among the Caucasian population than it was against people of color, with the exception of Africa, because apparently the continent of Africa, mostly which were under colonial ruling at that time, was hit badly by that pandemic. Some other lessons to be learned is that, lo and behold, social distancing was very instrumental in trying to respond to the Spanish flu as it is now. And one of the nice things about being an academic and teaching a whole bunch of different things, one of the things that I cover in my organizational behavior class is Hofstede's work-related values. And nowadays, if you read the newspapers or looking on television or read your news, electronic news, there's a lot of emphasis on how the United States obsession with individualism is preventing our society from carrying out a lot of the collective practices that are important in combating COVID-19. And there was a great study done. I always like to look for relevant research by some colleagues at the UVA. They don't normally turn out good research at UVA, but this was one example that looked at two counties in Minnesota, and using a standard cause of individualism, came to the conclusion that there's more resistance to wearing masks and social distancing in that county that is more individualistic than a neighboring county that seems to have indicators of more collectivism. What have we learned from the civil rights movement that's important today? Well, consistent protest, consistent arguing for justice. And I do mean persistent, because while we made a lot of progress in the 60s and the 70s, we know that there's still so much. I mean, I grew up in segregated schools in segregated Virginia. I could not have attended a VCU when I graduated from high school. And so I have to admit there's been some progress that has been made. A former provost of our institution, Grace Harris, was not allowed to study at VCU, and then she became, over the years, the second highest ranking position. So there's been a lot of progress. Maybe we're at 60% on a scale of 100, but that still means that we've got a lot of progress to go. But another important thing, which we've got to make sure of, that while we're looking at structural racism and police brutality and so on, we've got to recognize and respond to a Martin Luther King statement, which I use on my signature page: injustice anywhere is injustice everywhere. And so we need to develop allies, and we need to respond to injustices that are inflicted upon other groups of individuals, as well as on Black and brown communities. Government has to be a major part of the solution. Government is the cause of a lot of structural racism and inequities, and we must take the lead in eradicating them.
Thank you, Blue. You know, there's much work to be done by government for sure, and but government has never done it alone. And so we've also needed a lot of help from the nonprofit sector and the nonprofit community, which is important. And so I'd like to ask Seth to talk about how nonprofit organizations have been important partners in us as important partners as we fight against COVID-19 and racism. Any interesting trends that you might want to share with us that you're seeing in the nonprofit sector?
Of course, and thank you very much. First of all, the nonprofit sector is hoping to survive. Just to give you some idea of what the state is right now, an Urban Institute study found that at the last recession, approximately 5% of nonprofits from $50,000 and under closed. A Washington Post article that came out earlier this month suggested that almost 1/3 of nonprofits may not survive because the need is becoming so much greater, but the funds are going down. I think Chronicle of Philanthropy had an article come out, I think today or yesterday, which suggested approximately 50 to 55% of big donors are still giving it the same amount, but a lot of people are lowering. So at a time of great need, there's also a concern about employment within a lot of the nonprofits. The Tenement Museum just laid off 90% of their staff, which, you know, is a big area. So, of course, they're concerned about surviving and providing services in general. When it comes to racism and that double pandemic, what I think is important is that it's building on conversations that actually started before the pandemic. Social work, I'm a interdisciplinary. I'm a social worker and a public administrator. And the field of social work has actually been discussing how they have implemented and how they've been part of a racist history within nonprofits. So a lot of what we're seeing now in nonprofits is kind of building up on these conversations. How have nonprofits helped support racist policies, or what are the power dynamics within nonprofits, building on what Dr. Gregory had talked about, who is higher up in nonprofits, and what are the barriers for getting more diversity within some of these programs, such as money. In New York City, there's 5 schools of social work. One of the most popular one is Hunter because of cost. If you compare it to how much Columbia or NYU or Yeshiva cost, I mean, there's such an economic barrier to joining a field that doesn't pay very much, to be honest. So there are really interesting professional discussions around social work in the field of nonprofits too. How do we change our field and therefore the nonprofits so they represent better the people they're serving, which will then just lead to better services.
Great. Let me ask a follow-up, Seth. It seems like one of the ways that nonprofits have really been instrumental is in their use of social media as a way to sort of call attention to structural racism and to execute change. Is that a fair assessment, and what are you seeing there?
Yeah, so anyone who knows me knows I spend way too much time on Twitter. And you're really seeing more discussion. And actually what's interesting is Instagram as well. You're seeing Instagram accounts such as Change the Museum, where people are discussing racism that they've experienced in big museums, working in big museums, and the disparities that they've experienced. And all of these are, of course, anonymous reports. In social media, I think the important thing is, and I think the thing that differentiates this time period, is that you're seeing people holding nonprofits accountable. You're seeing people say, yes, you're saying Black Lives Matter, but your board is so white. And you're seeing people on social media responding to nonprofits and calling nonprofits out. And I think that's really where we're seeing a difference, as opposed to different points, and even earlier in the Black Lives Matter movement. We're also seeing blogs really holding funders and people accountable. Vu Lee, who runs Nonprofit AF, has been doing a lot of this work as well.
Great. So we've talked about government, we've talked about nonprofit organizations. I wanted to talk a little bit about universities, which many universities are government organizations as well, but some are not, some are private. And maybe asking Richard to talk about, you know, universities are certainly not exempt from racism and from the impacts of COVID-19. Prior to this, we were all talking when we were waiting for the webinar to start about what our universities are doing and how we're responding to the fall semester and all of that. Richard, do you see, are there any universities that really stand out, that they're really leading the way in terms of their response either to COVID-19 or to racism? And if so, what are some lessons that some of the rest of us can learn from them?
Well, you know, I think that's a very sage question, Susan. But if I leave a university out, then Dr. Woolrich will get me later on. So, so I think that I'm not going to specifically say which universities are leading. I think that we're kind of all in the same position, in that, as Petra said earlier, you know, we're still learning about this virus. So, you know, so certainly there are some universities that are better resourced, and of course they're in a better position to do some different things. I think what I would like to say is that there are specific fields leading the way at universities, and certainly public administration is one of those fields, right? And so we see that with, for example, DSJ. Under Sean's leadership, we've been having these panels all summer. And as you mentioned earlier, Susan, it has been a wonderful thing. We've had participation that has been staggering in each of the panels, and even this panel today, we're slated at RSVP. I believe Sean said it was 80, 85 or so, right? And so I believe that public administration, because of the work that each of us do on this panel regarding research and teaching and so forth, you know, we're able to sort of be first responders in how universities should lead the way, right? And I think that historically, universities have been conservative. I've been saying this for quite some time. And oftentimes universities don't react unless there's a knee-jerk reaction. But with scholars such as the ones, again, represented on this panel, and those attending, and some of our new assistant professors, we're seeing a sea shift, a sea change in how universities respond to things. So, I believe that the COVID-19 pandemic has caught a number of universities by surprise, of course, right? However, being able to attend to the needs of the university community is what's important, as well as the larger community as much as we can. But certainly, I believe that public administration has an opportunity to get it right, right? To help our institutions to get it right. And whether or not that's VCU or USF or Bridgewater State or Rutgers, it is a chance for the faculty in our field to say, this is how things should go about being done, right? We've got to respond to the needs of our students. It's a very traumatic situation for the students, and certainly students of color. A number of our students have lost relatives during this pandemic. And so therefore, public administration faculty, regardless of university, we've got to be there for our students, because there may be that president or provost that doesn't get it. So we have to show that we do get it, right? And the next thing that I'll say, just very quickly about this, is that, again, one of the reasons why public administration, certainly those in social equity, get it and are in a position to lead is because we've been writing on this topic for quite some time. You know, Susan, I know that you and Dr. Jay Berry just came out with a book on social equity. Sean and Mary Guy just came out with a book on social equity. A number of us have done articles on social equity, specifically dealing with disparities. And so, again, we're in a position to help lead the way, and we don't take our privilege lightly, because it is a privilege in that we have an ability to have folks at our universities listen to us. And that, I think, is a powerful thing. And then finally, just to be able to serve as a consultant for the president or the provost or the dean, as a faculty who's engaged in this type of work, is so extremely important, because again, we want to acknowledge all of the pain and suffering and hurt that has come out of this pandemic. And certainly, I believe that, again, public administration scholars who are engaged in this type of work have the ability to do that. So again, Dr. Gooden, I won't say which universities are leading the way. I would just say public administration scholars have the ability to lead the way during this pandemic. And I believe that many of us have been doing that.
Thank you so much. I just want to ask a couple more questions, and then we'll turn it over and ask questions that I know there are a lot of questions from the audience. But Patria, in your earlier response, you mentioned the impact of the dual pandemics on the Hispanic community. And I was wondering if you can elaborate a bit. What are you seeing as some of the primary issues that are impacting Latinos relative to COVID-19 and racism, and how might we address those?
Thank you, Susan, for that question. And I'm going to bring then the conversation that are happening in the public health field, because one of the things in our field that I feel is that sometimes we think that we are alone, but actually if we were to join forces, we could do even better with some other fields. At least from my perspective, Latinos or Latinx, Hispanics, and African Americans have very similar issues in terms of the COVID-19 and racism. These two populations share similar social determinants of health as defined by the Department of Health and Human Services. This means the conditions that this population share pretty much the same conditions in terms of where they live, work, study, and play. And social determinants of health are the biggest differences when it comes to health outcomes. So, for example, you see, the health status is not the result alone of healthcare or of biology and genetics, like some people would like us to believe, but they are actually the results of choices made by policymakers and providers. So in this regard, the CDC has estimated that anywhere from 60 to 70% of a person's health status is related to poor environment, their built environment, behavior, and exposure, all of which can be prevented. They are preventable, but that are attributed to the upstream policies that lead to this biological and risk factors. So for example, it is well known, you just have to go to the CDC webpage or the Healthy People webpage to confirm that poor housing conditions, poverty, poor access to care, food insecurity, all contribute to poor health conditions, and people of color are particularly vulnerable. And again, we know this, that there is plenty of research about this kind of disparities that COVID-19 magnify. So let me just bring some issues here. Statistics indicate that minorities, Latino and African Americans, and particularly Black and Brown Latinos and African Americans are at a disadvantage with regard to morbidity, healthcare, and chronic conditions like heart disease, diabetes, kidney disease remain I can say the word stubbornly and disproportionately higher among this minority. And COVID-19 is a very opportunistic virus that look for this kind of risk. And that's why we see that our communities have been affected so badly by the virus. But this is derived from their social determinants of health because they are particularly vulnerable. Now, what can we do about it, you ask? Well, on the other hand, there are studies that show that if we increase the economic power of these communities, we can help to address these issues and racism because they are interconnected. So for example, if we provide affordable and adequate, I'm talking about quality housing where people actually have hot water and heat during the winter, that would leave money for medicine, for schooling, and for better food. Because a lot of these communities also live with food insecurity. And we also find out that increasing education attainment can help to alleviate this kind of issues. COVID-19, again, just brought this to the forefront. Now, I will have to say that particularly for Hispanics, because you did ask that question, but I do want to point out what is shared among the community of colors. But Hispanics have the added concern of immigration status. That's just a reality. Let us take as an example, day laborers. Day laborers are essential workers. And those people that we were clapping at 7 p.m. every night because they were our heroes. And yet these individuals, many of whom are undocumented, they were risking their health. They were showing to work because if they didn't show up, they would lose their jobs. And that means that they would also lose their housing because they are housing insecure. And there was a study conducted by the National Labor Organization Network. And it shows that many of these individuals actually live with 2.2 children. Many of those children are citizens of the United States, but are not receiving the kind of protection that they are entitled to. So, but even if we leave aside the undocumented, a lot of Hispanics forego medical care because they don't have access to adequate medical care, they don't have access to insurance. So even before COVID, we were already having this situation. So, and in addition to that, they face a stigma of being an immigrant, and that stigma of being Black, brown, an immigrant has just increased with our current administration. So honestly, from my perspective, if we want to do something about this, we need to create policies that would not discriminate. As a society, we need to agree that the goal of government and governance, so just to include, to your point, Susan, nonprofits and the business industry, is our goal is to achieve the larger common good. And we need to see humans in their totality, not just in these different disparity policies, and develop policies that help to improve the social determinants of health. And it is only then that we will be able to eradicate a structural racism. Without this recognition and action, forget about it. We're going to continue talking about this in the next 100 years when we get, or the next 50 years when we get the next pandemic.
Mm-hmm. And Patrick, I think you make an important point that links back to something Blue mentioned earlier, you know, thinking about the undercount in the 1918 Spanish flu pandemic, because members of the community that may have not have sought out or been able to go to hospitals or seek out medical care. And we could very well have a large undercount with COVID-19, even though the figures are already disproportionately hurting Black and brown communities, particularly among immigrants and undocumented immigrants. It could be far, far higher. So, you know, that's a parallel as well. I'll ask the final question to Blue, and then Blue, I'm getting ready to call on you, so you can then respond however you want, but let me just get the question out, and then you can. You had mentioned earlier, the last thing I wanted to ask you about was that you had talked a lot about state-caused inequities, and you said that in your last comments, and I wonder if you could flesh that out a bit more for our audience, and thinking about that, what types of things relative to COVID-19 and racism you see that are key factors in reducing state-caused inequities.
Thank you, Susan. When the pandemic really hit forth and our various ASPA sections started responding to it, I tuned into one that was put on by the Conference of Minority Public Administrators that talked about COVID-19 and health disparities. And the speaker from Morehouse came up with a phrase that I have just stuck onto. I have a simple mind. I can only concentrate on one thing or another. Mr. Dawes from Morehouse talked about COVID-19 was not the great equalizer that a lot of people originally said, but was the great revealer. And certainly there's been so many Band-Aids pulled off of scars that already existed that have exposed inequities and then in some cases the causes of these inequities brought about, exposed by the COVID-19. For example, you talk about state-caused inequities. Well, right in Richmond, I keep pointing to the building I used to occupy, the placement of interstates. I mean, we all know this, but we need to make sure that we cover it in our classes. The placement of interstate highways, destroying what used to be fairly vibrant Black and brown communities, redlining. I'm just now being exposed to, which is something I should have known about, how, for example, black veterans were deprived from some of the benefits of the GI Bill. I mean, there's all kinds of things that government have caused in the past that are leading us to the, for example, the kinds of communities that enhance their inhabitants' susceptibility to crime, to health problems, educational problems, etc. So one of the things, and I'm delighted to say, you know, the National Academy of Public Administration's Standing Panel on Social Equity, which I hope that all of you, if you're not fellows, at least become an associate member. Laurie just joined us officially as an associate member. But it came out with a statement, or the Academy came out with a statement on social inequity back in 2005. It was the Academy that made social equity the fourth E of government, along with economy, efficiency, and effectiveness. And now, of course, we've got the grand challenge. And they said we need to analyze all of our government policies and programs to determine whether they contribute to social inequities and then resolve those. We've also recently come out with a statement that indicated that we need to do the same thing to examine government policies that contribute to systemic racism, so that there is a major role for government. We need to do that as professors of public administration. One of the things that's really very rewarding for me as being an old social equity, I first started talking about social equity in 1975, when many of you weren't even born yet. But the point is how much social equity has now risen in public administration and in public administration education. I'm hearing about all of these great new books. We know so many more writings from public administration scholars that focus on social equity. The number of classes, the Social Equity Committee of NASPA is planning on putting together an edited volume on social equity into the PA curriculum and giving examples of which we will reach out to all of you. But universities in general have not been leaders. In fact, if anything, they have been laggers. I encourage all of you at your universities to make sure that you have strong affiliation groups. At VCU, I had the privilege of serving as president of the Black Education Association. Sometimes we were very active, sometimes we weren't very active. But we need groups like that. We need the Hispanic groups, which we're just starting at VCU. We need the LGBT advocacy groups, and we need the Women's Caucus, and we need them to develop alliances to combat our injustices that are in our universities and that are caused by universities. I was just on a webinar over in Charlottesville, and they talked about the fact that because of the pandemic, the food service company, the same one that we have at VCU, have laid off about 175 food service workers. The vast majority of those people are going to be at the lower income level, and they're going to be Black and brown. What are we doing at our universities to protest that? In all of our contracts, even though the universities might say, well, we're not doing furloughs or we're not doing layoffs or things like that, but through our contracts, they are doing layoffs and furloughs. And a lot of the people that are being impacted by that are the disadvantaged, the marginalized populations. And you can do a unveiling the great revealing those inequities at your universities by developing these affiliation groups and making sure they're active and are persistent.
Right.
End for the day.
Well, thank you, Blue. I know we've got about a little more than 30 minutes left. We've got several participants. I know there have been some questions that have come in through the chat feature. I'll ask Sophia if I know you had a few questions, if you could maybe concisely, if you want to, if Sean, if you can unmute Sophia so that she can ask her question.
Oh, sure. I've been communicating with Sophia, and she would prefer if I ask the question on her behalf. So
Okay.
I will go ahead and post this in the chat. This was specifically addressed to Patria, but I was hoping that everyone could chime in. It was really, how can we analyze accountability processes and measures to make sure that they actually hold the powers that be accountable beyond data collection? And it was in the context asked of how do we go beyond simple writing of reports and data collection and to making these accountability processes and measures substantive and holding people accountable. So there we go. I went ahead and put that question in the chat, and those specifically with Patria, but if anyone could chime in, that would be great.
So if you want, I can start.
Great. Yes, please.
Okay, so yeah, I saw the question. That's a great question. But what is interesting is that I've actually been studying this issue because we have been producing report after report. And that's exactly what I was saying, how we have the data out there, but nobody's doing that. And the problem is that collection and dissemination of data are only like the first step in accountability, a very important step. However, if that information is not being used for action, then we have nothing really, then we don't really have accountability. Now, there have been some programs, and I'll come back, for example, the No Child Left Behind, when they tried to hold schools accountable based on the information that they were disseminating about the lack of accomplishment. But guess what? The methods by which they did this were even worse. So it's like, it was kind of like the cure is worse than the disease, because then they started to take the money and the resources from those schools. And in some cases in New Jersey, for example, the state took over and they still haven't been doing well. So I think this isn't really, it's a matter of, are we really prepared as a society to make people accountable? We are not. And then Sophia also added the issue about maternal health. My gosh, African-American women keep dying in childbirth. Why are we holding the system that provides them with prenatal care and follow-up accountable for this? And I'm not talking about necessarily the providers, but it is just the way that the system is set up. And when you set up the system to be, to actually be biased against this community, which I'm sorry, but that's what I see, there's no amount of accountability measures, there's no amount of performance measurement that we can do that is gonna fix it. Because as far as I'm concerned, there isn't really a desire to fix these issues. If there were a desire, we would have consequences. But many of these things, the kind of consequences tend to be worse. We can just go into our criminal justice system, for example. I mean, I'm not a lover of 3 times you're, what kind of policies are the 3 times and you're out? I mean, that stuff decimated communities of color, and our criminal justice system continues to decimate them. So what the kind of cures that we are coming up with are fraught with racism within them. And we really need to have woke people, or whoever it is that's going to come, because our generation failed to change this. We need you to come in there and start making the changes that are necessary, because no amount of performance measurement is going to do it. And that's really what I'm saying. So I've been studying this stuff, and you are absolutely correct. Unless we use the information to make change, nothing matters. It just really, nothing matters.
I think I'll just follow up on that, Dr. Gooden, if I may.
Sure.
I absolutely agree with our dear colleague, Dr. Guinness, I mean, who's made some very sage points and some sage comments. I would add that, along with the data collection and all of this stuff that's done is really just a complete ignoring of what that information is telling us, right? And so, for example, this past summer, well, just up until last Saturday, I taught an MPA class on program evaluation. And it's kind of the same situation, right? Whereby you do this evaluation and you get the results and then it sits on a shelf. And that to me is criminal, right? And, also I've got to add, going back to an earlier point, that so many universities conduct these diversity surveys that they do across campus, right? They do the surveys and then you don't hear about them. You kind of get some of the results, but nothing has happened, right? And so those structural issues that Sophia talked about are still present because they haven't been dealt with. There may there may be a policy change, but that's it. So it's really a situation whereby people on the surface, leaders and the like, they want to sort of give the illusion, perhaps, that they are taking these things seriously, but the truth is that they're not. And finally, I will say, and as everyone on the panel knows, that I lost my father during this COVID pandemic, and 2 aunts, and so all within the same period of time, all within that New York, New Jersey area. And so I'm very keen to find out what type of information or what type of actions are specifically going to be done from the federal level regarding all of the lives that we continue to lose, specifically Black and Brown people during this pandemic. So for me, this is a very real situation, and it's a nightmare that that my family and I continue to live. And again, going back to the question, and Dr. Petria's comments, these structural issues are ever present in program. There's no program management system that will attend to any of this if there's not a sincere desire to have these issues corrected.
If I may add from the nonprofit perspective, and thank you both of you for great points. From the nonprofit perspective, data is just so controversial. To give you a personal perspective, my first job out of social work school was in foster care. And the main data collection, the main data point was how quickly are we getting the child out of the system? Not what is the best interest of the child. It's this 18 months and then they're up for adoption. It doesn't matter what I've done for the parent, and I can get into more complexities just into foster care. But when we talk about data and accountability, we have to think about what we're asking nonprofits to collect, and is that really getting to the point? We also have to ask if there's always the question, even before all of this, if we're asking nonprofits to collect data, are we paying them for it? I've done several free consultations for nonprofits to collect data because I did a project for a small nonprofit that I collected data that they already had, just it took time that they took me 5 minutes, but it would take them so much more time. And I think that leads to my third point, which is when we ask for data, we are discriminating against smaller and community-based nonprofits that don't have the time, don't have the manpower, they're volunteer. And that really does lead to the question of if we're going the accountability route just on data, which nonprofits are we really supporting? And do those nonprofits really represent the communities? So I think that's just the nonprofits.
Susan, if I may.
Thank you. Go ahead, Boo.
In fact, I'm glad that you let me speak because I'm going to say something good about you, which is very rare. But when Gooden was vice president of ASPA, one of her responsibilities was to appoint a couple of people to the board of the Center for Accountability and Performance. And in doing so, she became much more knowledgeable, maybe, about the center, and discovered that the center appointed research fellows to do work in performance measures. And I was chair of the standing panel on social equity at the Academy at the time. So she gave me a call to say, what happens if we all get together and do a call for research fellows in performance measurement in social equity? And so the three groups, ASPA, the Center, and the Standing Panel on Social Equity, designed this call. It went out. We got two great teams of now leading scholars in social equity, Brandy, Tia, and Mark Fudge of San Bernardino was one team, and Benet Jacobs and Sam Lawson, who might be on, was another team, and they did research, presented it at our different conferences, regional conferences, NASPA, COMPA, and so on. And those packages are available for those of you who want to follow Patria's lead and incorporate social equity measures into your curriculum, evaluation, program management, etc. I urge you, I assume they're on the CAP website. If not, we can certainly put you in touch with where you can get copies of these two packages. And they're really very useful. I mean, I used to teach finance, and Lord knows, a course in finance is a way to maximize attention on social equity, both for our graduate students and also for the practicing public administrators that we serve as consultants or provide technical assistance to. So increasingly, there's resources out there for us to use to reduce inequities.
Okay, thanks so much, Blue, and to all the panelists. Seth, you want to ask the next question? Oh, I'm sorry, Sean, you want to ask the next question?
Yes, absolutely. So Seth, this question was, this comment was directed at you, and hoping you could weigh in on this. This is from Don C. Rice, who has asked me to raise it on their behalf. So he'd earlier mentioned, he said, Seth, the collapse of nonprofits could be a good thing. Most of the higher ups in nonprofits are reflective of white power structure. This may be an opportunity to diversify. And Dr. Gooden and I just wanted to give you a chance to respond to that if you'd like.
So before this, I was writing, as we all do, and I'm working on a chapter right now called Burn It to the Ground. I like pithy titles, and I am a queer theorist. One of my areas is queer theory, where we really look at power structures. And in the nonprofit sector, there's so much power, and it's racially especially, a power differential between the higher ups, especially at the major nonprofits, and the structure, who they're working with, that I think that a real deep dive and a real examination within the field is so important. And I think one of the important things is we are really exploring the racist histories of nonprofits. And I've been teaching some of this since I first started teaching 5 or 10 years ago, with some of the ways that some nonprofits started with wealthier white women visiting or houses in attempts to, I guess, make people feel better. But I think that we are now really deep diving into these complex racial structures that hopefully will create long-term changes in the way we understand the power structures of the nonprofit and the powers that nonprofits have within communities. So I could do a whole webinar a long time on this. So.
Maybe we should.
Oh no, I just said yes to something, didn't I?
And
Sean,
DSJ will take you up on it. So
Yeah, Sean, I just got a text saying from someone who got kicked off, and would you please let them back in?
Oh, sure. I've been keeping an eye on the list. If they sign back on again, I'll be sure to let them in.
okay, Sean, next question.
Okay, Dr. Gooden, the next question is directed to you. This was something that someone asked me to ask on their behalf. I'm going to put it in the chat as well. It says, thank you for moderating this panel. Given your book, Race and Social Equity, what do you think are the essential things to do to foster social equity in this double pandemic?
Well, I can't get away with being a moderator, huh? I've turned into a panelist, a dual role. No, thank you so much for the question. I'm happy to share my thoughts. You know, one of the things I think it really needs to happen is that we need to apply many of the measures from COVID-19 to racism. And what do I mean by that? I think that we need to be looking across pandemics, because even though we're having these dual pandemics, I don't see this dual sense of urgency. So for example, with COVID-19, there's the, you know, let's get the trials going. Let's try to get a vaccine as soon as possible. You know, it's a high priority item. We have a sense of urgency, and we're looking to see, you know, where are the issues and what can we do to resolve them. With racism, I still hear too much about let's have a discussion, let's have courageous conversations. Let's talk about, you know, the other day I got an email from, I won't list the organization, saying, you know, would you be interested in facilitating a conversation? I said, no, I will not. Because we, on the racism front, and we look at COVID-19, we are deploying two completely different strategies. COVID-19 is a problem. We are trying to solve it. Racism is viewed as a condition. We're trying to manage it. So we need to look at racism and redefine it like we're defining it as COVID-19, which is a problem to be solved, not a condition to be managed. So that's one thing. The second thing I think we need to do is to apply this concept of comorbidity. We've been looking at comorbidity in individuals relative to COVID-19, but we need to be looking at comorbidity in organizations relative to what are some of the underlying conditions that localities have regarding racism that is going to impact structural racism, that's going to impact outcomes relative to COVID-19. Some of the early data suggests, for example, that cities that have been engaged in racial equity work, like the city of Seattle, long before COVID-19, even though the city of Seattle was hard hit initially, that they are not having the racial disparities to the same levels as some other cities who have not been part of the Governing Alliance for Racial Equity and who have been doing this work in racial equity. Why does it matter? Because they had already had on their website information that was available in multiple languages to kind of help offset. So they had done a lot of that work. A lot of organizations and a lot of cities and localities, I fear, that have been managing the comorbidity of structural racism and have not been working to eradicate it, I think are not going to fare as well in terms of those outcomes, because they don't have that layer of protection that other cities and localities that have been aggressively doing this work may be better situated in terms of their outreach to communities, in terms of being able to get messages out and to already be thinking about equity in terms of their services and their responses. So those are just a few things that, you know, a couple things that I would say relative to the dual pandemics and how can we have the COVID urgency and apply that to racism.
Hey, could I add a couple more things to what Susan was just saying? And then just actually bring us back exactly to Washington State. I felt like this in King County, which they're always at the forefront, you know, I mean, that's just their reality when it comes to performance measurement. But the Washington State actually is tracking communities at risk, and they have defined those population at risk. they have defined those as, let me just give you the correct language of how that performance measurement is defined, because while this is not exactly about them dealing with directly with racism, it gets to it. So they have protecting high-risk populations. And what are they doing? They're looking at the outbreaks reported by week. How? They are defined as 2 or more non-household cases, epidemiologically linked within 14 days. Key here, a workplace, congregate living, or institutional setting. Think about, for example, just workplace. How many people working in meat packing, in the meatpacking industry, the people who are working just in our supply, food supply chain, those are brown and black people. And nobody really, and they are raising their voices because they are getting sick, they are dying, and they are not receiving the protection they need. This particular performance measurement from Washington State actually gets to this by being sure that they are tracking what's happening in the workplace. I haven't seen that in a lot of places doing it. So this is a great step. And these are the kind of measures, the kind of tracking that we can do, but we have to be consciously, instead of just stop the conversations and start acting, consciously acting to address the issues that are being revealed every day by the COVID-19 epidemic, just like you said, Susan. So they are a great example, actually, in Washington State as a first step in what we can do.
You know, and just to add to Petra's comment about Susan's comment, you know, I think we have to also, again, get to the intent of our leaders, right? Our political leaders, our university leaders, our community leaders. There has to be that desire to really understand how this pandemic is impacting Black and Brown communities, right? I mean, there is so much resistance, I believe, from a number of different entities that to want to name what's going on, right? Because when you do this, you rip the Band-Aid off, as many of us were saying during this conversation, and nobody wants, or very few people, certainly in control or in leadership positions, very few of them want this Band-Aid to be ripped off, because it is very clearly showing what is to be considered a systemic issue. So that's the good thing about this pandemic. If there's anything at all, if there's any good about this, it's showing what so many of us have been writing about and talking about and marching about for years and years and years. And so finally, we are beginning to have other people acknowledge, right, what we've known. However, there are still those who don't want to, and that's the problem, right? So again, as Petra said earlier, we're dealing with a structural issue. Nothing will change until we deal with the structural nature of racism and its fallout over decades and centuries.
It's been interesting over the last 20 years in our writings, including some of the people on the panel, about why should people be concerned about inequities. And it started out with it's a moral issue, and then some of us pointed out that it's an economic issue because the cost to society of inequities is quite high. And then Gooden in her book talked about the fact that we need to be concerned about it for legal reasons and also for political reasons. I think one of the areas that we need to focus on now, and going back to Ricardo's point, is not only what is the cost to the Black and Brown communities of inequities and racism, but what is the cost to the rest of society of inequities in the Black and racism on the Black and Brown communities. You know, we're all kind of mourning the loss of George Frederickson, but one of the things, and quite rightly so, one of the things that George Frederickson did at one of our social equity leadership conference was introduce us to some books written by this English couple of Wilkinson and Pickett, The Spirit Level and the Inner Level. Excellent books because they provide research that shows the dysfunctional consequences of inequities in society. And I really encourage you to get copies of this book and read it and use those examples. You know, I follow that great moral philosopher, Chuck Colson, who, as you know, used to be advisor to President Richard Nixon. And Chuck Colson once said, before he got religious, he once said, if you grab people by vulnerable parts of their anatomy, he had a different term, their hearts and minds will follow. And I think that some people will only be convinced to eliminate inequities when they recognize the damage to society and to their populations caused by these inequities.
Great. Oh, go ahead. Seth, if you want to jump in?
If I just may have the nonprofit perspective. Nonprofits are always worried about this fine line because there's only so much under a 501c3 designation advocacy you can do. But there is advocacy that a nonprofit can do, and a nonprofit should take part in this because it really does impact their clients. And one thing we can really do is encourage nonprofits to work with their clients and in having their clients advocate so that they are gaining more control, and they are instead of being just clients, they are also people who are fighting these inequities and showing how we can do better and what the nonprofits and the culture in general can do better. And Blue, if you could just put the book into the chat so we can see it, because it was going in and out.
Thank you, Seth. And while Blue is doing that, let me turn back to Sean. I think we've got time for one more question, and then we'll hand it back to you, Sean.
Okay, excellent. We had a question from Stephanie Dolomore, who has asked me to ask it on her behalf, and it's specifically directed to Dr. Junith. So I'm just going to put it in the chat right here. It says, knowing that we can't capture every quantitative data point for many reasons, as Dr. Junith mentioned earlier on, what role does qualitative data play in addressing social equity in the time of these dual pandemics?
Thank you, Dr. Delamore, for that question. I actually know Dr. Delamore, so happy to that she's out there. Well, you know, it is, if we didn't have the qualitative component, the numbers that we are getting would mean nothing. For example, if we didn't know the issues with this, the zip code are a great data component, and they are showing us the spread of the disease among the communities of color. But we don't know the real stories that were going on there. Just like I was saying, for example, if we had those four additional points, we could actually look block by block to look at the differences and see if there are some racial inequities, which I know there exist. But it is because of these stories that people are telling us, and granted, some of them are anecdotal because, as far as I know, no one is out there. Well, I'm sure somebody's out there getting to doing some qualitative data collection, but at least we are getting the stories of these different individuals. And some of the stories are coming out, for example, out of Texas, for example, where the Hispanic community is being decimated by this virus. Without the digging of the journalists, for example, we would not have these stories. So whether, for me, we need to have, in any event, we really need to have this triangulation. Basically, we're looking about data. We need to have the qualitative component that is going to tell us what's going on in these communities, because really just having the quantitative data it's just not enough. We wouldn't have enough information for us even to have this kind of conversation. So I think that their role is extremely important, not just to fit a gap, but actually they are complementary. Not just, and they shouldn't be thought of, the qualitative data points should not be thought of as an afterthought, but as something that really enriches our understanding of what's happening in their community. I hope that that answers the questions, as I know that we are a little bit out of time.
Thank you so much, Patria. And I just want to thank all of our panelists, Blue, Richard, Seth, and Patria, for the outstanding insights that you have offered. Blue, you noted that the COVID-19 is being talked about as the great revealer. I think we've had some outstanding revealing insights from this panel as well. And so I thank each of you for your outstanding comments and for the depth of discussion and the complexity of these issues as we look at the intersectionality between COVID-19 and racism. So with that, I will turn it back over to Sean, who is our master leader for the session today.
So I just want to thank you, Dr. Gooden. A big reason we are talking about the dual pandemics today is because of the statements that you have made. Thank you so much for moderating this panel and for everything that you do. And of course to our four amazing panelists, Dr. Rickard Gregory Johnson III, Dr. Patria de Lanza-Yulnath, Dr. Seth Meyer, and Dr. Blue Wooldridge. Before we go, we'd like to invite DSJ member Dr. Lorenda Naylor to talk just a little bit about a book that she has coming out. So Dr. Naylor, you should be off mute, and then we'll just wrap up from there. Dr. Naylor.
Yeah, thank you, Sean. Really appreciate it. And I want to thank Susan Gooden as well for moderating this important panel on race and COVID-19. And I think you're right. It's about how do we solve the problem of racism. And one of the things I also want to share real quick is, Blue had made a comment earlier, and his recommendation was that in order to break down structural racism, we need to create alliances and partnerships. And one of the books that I have coming out this January, and I would certainly suggest building that alliance and partnership with the LGBTQ community. And the book is titled LGBTQ Rights and Social Equity, Dismantling Discrimination and Expanding Civil Rights. And what I do in this book is I link and connect social equity to LGBTQ legal rights. And this is based on analyzing landmark U.S. Supreme Court cases, such as the recent Bostock ruling, which specifically addressed employment rights, as well as federal policies, which were largely based on executive orders. And there's still more work to be done, but the book will be out this January. And if you're interested, I can certainly send you a copy of the book design, the cover page, if you will. But I'm excited about it. And, I owe a lot of thanks to ASPA, the social justice section, the LGBTQ section, in writing the book. It's been a great place to explore this in panels and conferences, and all of you have been such a big part of this, and just want to thank everybody for their support and also keeping us all focused on what's important here. So thank you so much for being able to make a plug for this, and thank you for an excellent, excellent panel today. Greatly appreciated. Thank you.
And thank you. Okay, and so everyone, I believe that is time. So again, I'd just like to thank our four amazing panelists and our moderator. Please keep an eye out for the recording, which we're going to review with the panelists before we release it. And I just want to say to everyone, thank you for attending today, and we hope you attend our future webinars. And we just hope everyone has a great day and stay safe.